Well, good afternoon or good morning, depending on where you might be located today. And thank you all for joining us for our webinar here. We're going to give it a few minutes as folks continue to log in. I know it's just 1 Eastern time. I'm located here in Atlanta, Georgia. However, while we wait, why don't we take a minute just to type into your chat box there, what state do you reside in, or what state might you be in today? Let's start to hear from some folks. I see Tennessee, New York City, Maryland, Connecticut, Boston. Looks like we've got kind of this East Coast covered pretty well. Anybody in Central? We've got Arkansas. Excellent. California, there's our West Coast. Wonderful. As folks are joining, please just type in the state that you might be either visiting today, working out of. And it looks like we've got a number of different cities and states represented, which is very exciting. We'll give it just another minute or so. We only have one, it looks like just one out west from California. Or folks are, there we go. I see Sacramento, California. Excellent. So we've got states coming in here. Wonderful. Well, again, welcome. We're thrilled to join you all today to talk about the home as a clinical hub for closing SDOH-driven care gaps. So over our time today, we're going to just get through some housekeeping items here. Today's conversation is extremely imperative and critical as we continue our work towards really driving closing gaps in care. But a few housekeeping items. Please know that all lines are muted. We are going to use the Q&A box at the bottom of your screen. We will get to the Q&A portion of the presentation at the end, so please type in any questions that you may have into that chat. We are recording this meeting as well, so this webinar will be recorded for your convenience here later on. So let's get started. We're going to watch a short video. It's less than a minute and a half of your time, and it's going to really help set the stage for this important conversation.
My health is so important to me, it's everything.
Finding the care that I need is a struggle.
It feels like there's always an obstacle.
As a trans woman, I've always felt so uncomfortable going to the doctor.
Healthcare is not made for people like me to understand.
It's just so not patient-friendly.
I went to a clinic and I was discriminated.
I was definitely misunderstood and not heard.
If I had not demanded that I have my breast examined, I would not be alive today.
I went when I was 49 to have the colonoscopy, and I was diagnosed stage 3. If I'd waited till I was 50, it's likely it would have been stage 4.
I believe in prevention. If I can do something at home, I would do that.
If I could access healthcare from home, it would be a game changer.
I took an at-home colorectal cancer test. Without that, I wouldn't have known.
STD tests at home. It's so convenient. You have the privacy.
It's easier for everyone.
It saves lives.
I wouldn't be a grandmother if I hadn't tested myself.
It would be very empowering to know that I have the ability to take charge of my health.
Knowledge is power.
I suggest 100% that everyone is their own health advocate.
Healthcare should empower you.
Great. You know, as you can see, it is empowering to take charge of your own health, all from the privacy of your own home. So let's get started with some introduction, shall we? My name is Bina Thomas, Head of Strategic Partnerships at Let's Get Checked. I've spent about 26 years of my career in the population health space, about 10 years at Anthem in a variety of roles, after which I joined Optum for about 8 years. In the last 6 years with Let's Get Checked, working with the largest strategic partnerships that include health plans, employers, and other partners. Really improving health and overall well-being has been part of my DNA, both personally and professionally. Jay, I'll turn it over to you.
Thanks, Bina. Good morning, good afternoon to everyone. My name is Jay Picklesheimer, and I support the strategic accounts on the employer side of the business, especially the resale side of the business. I've been in this space for about 5 years. Prior to that, I spent quite a bit of time at Walmart in their healthcare entities. So whether it was pharmacy, and I was part of the team that launched their clinic model. So really committed and find that access to care is one of the things that drive me. So really excited to spend some time with you all today. Patty?
Thanks, Jay. So, Paddy Owens, I'm actually from Patients Like Me, where I lead commercial partnerships and growth. I've been in the healthcare and pharma space for about 10 or 12 years, leading finance and commercial groups. Patients Like Me is the most powerful engagement and community platform in the US. So, just give folks backgrounds. We primarily partner with pharma to help engage and activate patients across the healthcare journey. So our goal is basically to help patients improve their confidence in health literacy so they can make better choices and take charge of their own healthcare. Ultimately, this helps them to get to the right therapy, stay on the right therapy, participate in research and improve their quality of life. But excited for the discussion today.
Great. Thank you both. Let's take a look at our agenda. Over the next 40 or so minutes, we are going to be covering social determinants of health, provide a baseline understanding of SDOH, looking at the consequences of the lack of access, of health literacy, really honing in on the home as a clinical hub, extending that longitudinal care and support. And then at the very end, we will get to Q&A.
One thing I want to say is, we all would agree that healthcare times can be challenging. And that's something that's a mission focus for our organization. And to kind of speak to that, I'm excited to introduce Fuse Health. So Fuse has brought together organizations that are proven patient-focused, technology-enabled healthcare innovators. We are working to solve those complex problems in the patient journey by including genomics and digital pharmacy to wrap around the diagnostic and engagement tools that we already offer today. We know that members and patients demand a streamlined healthcare journey, and with the combined power of Fuse Health, we can meet them where they are. While working with the brands you recognize in the future, you will see our branding change to say things like powered by Fuse Health. We're doing that to show the ecosystem that we are building to help wrap around patients and help them through this journey. Bina, can you tell us a little bit more about Let's Get Checked?
Absolutely. Consumerism is fundamentally about placing individuals at the center of that healthcare experience. It's about enabling retail-like choices and better decisions through access to personalized, relevant information. Let's Get Checked is just that. We are a vertically integrated at-home diagnostic solution offering valuable health insights, convenient at-home health diagnostics, telehealth, all from the privacy of one's home. It's these testing capabilities that really enable our clients to address a variety of chronic conditions across multiple populations. And I would say meet them where they are, which in turn drives engagement. It drives adoption. It really improves overall health status. And it's this unique blend of consumer experience and clinical content, which help our clients achieve their goals. It's what drives the mission of our own organization, which is really to empower people to take an active role in their health to live longer, happier lives. Now, Patty, PLM offers quite a unique offering in the marketplace as well. Could you provide the audience a little bit more information and background?
Yep. So I think you kind of covered our mission statement is pretty similar in that we want patients to take charge of their own healthcare journey, feel empowered to drive their own decision making in combination with their doctors. But I actually think that that's where the PLM and Let's Get Checked are such powerful partners to improve social determinants of health. I think it's the combo of engaging patients directly via PLM, raising awareness and education of risk factors that patients might not know are there, and then helping patients navigate easily to relevant screening that's available to them all in one journey. I think that's pretty critical because Jay mentioned it. The US healthcare system is a beast. It's incredibly confusing, and we are all in this space, presumably everybody listening as well. The reality is that the average person doesn't stand a chance, right, when it comes to knowing what they might be at risk for, what they should get screened for, and then how to go about that. So I think particularly in an SDOH context, the digital engagement is kind of key, right? It's especially critical for patients in rural communities who might not have the same access to primary or specialist care. So I think between us, that combined capability provide a really patient-friendly way to flag relevant screeners at a population or community level, and then actually guide patients appropriately. And I think some of the cool stuff is on the other side of the testing is, as part of this Fuse network that I'm sure we'll touch on later, is we can actually help patients understand their results, take their next, action, and then put them on the right care pathway, all within one singular experience. So I think it's pretty cool.
Agreed. Agreed. Very good. Well, let's take a closer look at really social determinants of health. Health isn't just about doctors, it's not just about medicine, it's also about where you live, what you learn, who supports you. When we talk about social determinants of health or SDOH, these are the non-medical factors and environmental conditions that influence a person's health outcome. They may include things like where you're born, where you live, where you work, where you worship, age. Those are all factors that play into this. Jay, we know that medical care only accounts for a portion of health outcomes, and many experts estimate that these social and environmental factors that we're talking about play a much larger role. Could you tell us a little bit more?
Absolutely, Bean. And just kind of double clicking on your comment, the healthcare system today, so much of the journey of someone's health actually is starting for the first time when they're in a clinic, at a doctor's office, or at a hospital. That's when they're introduced often to healthcare. But the data shows that that's only a small percentage of what actually drives health outcomes. In fact, only about 20% of health outcomes are influenced by the healthcare system itself. That's access to care, quality care, and treatment. The remaining 80% of health outcomes are shaped by factors completely outside the clinical setting. That means health is largely created and really lost in the environment where people live and commute to. If we focus only on what happens inside the clinic, we are choosing to address just a fraction of what determines a person's health trajectory. The largest determinant of health is actually social economic stability. Things like education, employment, social support, income, and community safety. These factors influence whether someone can consistently manage their medications, maintain routines, and access healthy food, which directly impacts conditions like diabetes, hypertension, and obesity. In fact, a patient's zip code often predicts their health outcomes better than their genetic code. Another 30% of health outcomes are driven by health behaviors, and those behaviors happen mostly in the home environment. These are factors like diet, exercise, tobacco and alcohol use, and other lifestyle decisions, and those decisions happen 365 days a year in individuals' home and places of work, not during that 15 to 20-minute clinic visit. We also have to consider the physical environment, housing quality, air quality, and environmental exposures that we experience. For example, someone working in a construction or agriculture environment may appear healthy, but long-term dust exposure can actually increase the risk for conditions like chronic kidney disease. So when we step back and look at the full picture, healthcare is essential. We can't say that enough. It is essential, but it represents only about 1/5 of what drives health outcomes. Historically, health systems, health education, health outcomes has been designed around healthcare systems, and that's only 20%. But if most of the factors that determine health live outside the healthcare system, then our care delivery model needs to move outside the clinic as well. To improve health, we must find a way to make the right choice for people and help them make the right choice, and that needs to be an easy choice for them. Bina, can you tell us a little bit more about lack of access and health literacy and how it impacts most of us here in the United States?
Absolutely. According to 2025 data, over 80% of US counties lack proper access to healthcare services. That includes things like pharmacies, primary care, and hospitals. Now, it's this healthcare desert crisis that's marked by over 1,000 pharmacy closures, for example, severe primary care shortages. And it's these shortages that create significant delays for individuals in managing their chronic conditions or seeking care, particularly in rural and perhaps low income communities.
When we talk about the consequences of limited access to care and gaps in healthcare literacy, we see the impact very clearly in the prevalence of chronic diseases across the United States. I think it's important to take a moment and think about health literacy. Often when we hear about the words health literacy, it's like the person isn't educated about healthcare. That actually isn't always correct. Someone could be extremely educated about the system and what happens, but something like stress or a diagnosis of a disease can actually impact that patient's and that member's ability to understand what's happening. So it's really important that we need to understand social determinants of health impact all of us, and we can shift through the journey throughout our healthcare journey. Today, an estimated 129 million people in the United States are living with at least one major chronic disease. And what's even more concerning is that many Americans are not dealing with just one condition. They're managing multiple conditions at the same time. In fact, about 42% of Americans live with two or more chronic diseases. These conditions include diseases like diabetes, cardiovascular disease, chronic kidney disease, respiratory illness, and cancer. What makes this particularly important in the context of social determinants of health is that many of these diseases develop slowly and often without obvious symptoms early on. When people lack access to screening, education, and ongoing engagement with the healthcare system, those risks often go undetected for years. By the time patients finally enter the healthcare system, the disease is frequently more advanced, more complex, and more costly to treat. And that's why expanding access to care, especially through screening, telehealth, and support in the home, is so critical to identifying risk earlier and improving long-term health outcomes. Patty, can you tell us a little bit about how patients like me can impact health literacy?
Yeah, sure, Jay. So, education and awareness are a big part of what we do on PLM. I think the cleanest way to talk about this is maybe talking through what we see in our CKD programs, right? So that's a clinical condition with a big social driver behind it. And it's kind of a perfect example of where healthcare breaks down between doctor visits. So, like a big thing about CKD is that people don't realize just how prevalent it is, even though it's a major driver of US healthcare spending. There's something like 40 million Americans who have chronic kidney disease, but I think upwards of 90% of people don't know it, right? So the reality is that patients don't even know what CKD is. They don't know the risks of CKD, even when they have huge risk factors or common comorbidities like hypertension, obesity. And that's kind of a big factor in why there's such a high percentage of patients who actually crash into end-stage renal disease. And what's most shocking is actually that CKD is something that can be reversed with improved nutrition, improved exercise, and there's also meds that can slow progression by 30 to 40%, but most patients don't know to look out for it. They don't know to get screened for it. Um, and so they miss on that opportunity. So I think it all comes back to like why this like joint model of being able to engage at-risk patients proactively early to raise education of risk factors and promote screening is so important. Um, you know, I think about the combination of PLM's community and Let's Get Checks kidney screening as a way to catch this early and get patients diagnosed and on the right care pathway early as being kind of a critical piece and part of this larger home as a clinical hub idea. Um,
Let's talk a little bit more about that, Patty. Actually, you just took the words right out of my mouth, just in terms of the home as a clinical hub, and this notion of how this really is a growing model. Is that correct? I think you were going to give a specific example of at-home dialysis, if I'm not mistaken.
Yeah, no, that's spot on. Yes. So I think the home as a the home as a clinical hub is so important for SDOH because bless you, Jay. The reality is that most people can't just nip out to a doctor's office for multiple visits, right? It's hard to just take a few hours off work, especially if you're paid hourly or it's a long visit to the doctor's office, right? So um in terms of some of the at-home dialysis programs you mentioned, another big program we've been involved with over the years is helping patients with end-stage renal disease understand if they're at home, if they're a candidate for home dialysis versus in-clinic dialysis, right? So that's huge on a number of fronts. One, it saves the payer about $60,000 a year versus in-clinic dialysis per patient. And more importantly for the patient, it frees them from 3 or 4 days where they're spending the entire day hooked up to a machine in a dialysis center. So the benefits are just huge. And beyond that, it's kind of like getting patients to a place where they understand their disease, they understand how to manage it so well that they can ultimately get on a path to something like a transplant list. But I'm sure you guys actually cover this a lot more closely, even with Let's Get Checked. So uh, feel free to weigh in.
Absolutely. Thanks, Patty. It is this idea of home as a clinical hub that, as I mentioned before, is not just a growing model in healthcare where a person's home is the central place for delivering, for coordinating, even for managing that care, but it connects closely to social determinants of health because it brings care into the environment where they actually live, where our patients actually live. So the key components of this might include technology, let's say, data that's sent to providers in real time, perhaps telehealth visits that may replace some in-person appointments. It's the convenience factor that allows for that. Now, I have a specific example, one in which my neighbor, an individual with type 2 diabetes, uses a continuous glucose monitor. That then alerts their physician to any dangerous trends that might be in place. And so that's a great example. Another key component that we've talked a lot about is the at-home testing piece. This addresses those who may not otherwise get healthcare, get the actual healthcare they need, maybe due to transportation issues, or perhaps they're living in a rural community. So all of this directly addresses SDOH. It's not just the symptoms, but it truly is pinpointing social determinants of health. Let's take a look at chronic diseases in America. When we talk about chronic diseases, these are topics such as heart disease, cancer, diabetes. These are the leading causes of death and disability in the United States. It affects 6 in 10 adults, often caused by tobacco use, poor nutrition and diet, inactivity, and they're largely preventable conditions that account for 90% of the nation's over $4 million trillion annual healthcare costs. Jay and Patty, did you know that over 50% of American adults live with at least one chronic condition, while nearly 1 in 3 have multiple conditions? So we know that chronic disease causes 8 out of 10 deaths in the United States. And really, having worked with some of the largest employers and health plans in the US over these past couple of decades, specifically in the space of health and well-being, I can tell you this is not going to go away anytime soon. We continue to chip away at it, and we will continue to figure out this puzzle, as I would say, holistically within the healthcare ecosystem. And employers, when we take a look at that vertical of ours, they grapple with chronic disease, such as type 2 diabetes, such as heart disease, and they can drive higher premiums, increased costs, absenteeism. I mean, the list goes on. And Jay, specifically, we know that many chronic diseases increase the risk of developing cancer in the first place. Can you tell us a little bit more?
Absolutely, Bina. Yeah, I think it's really important for us. We talk about cancer and chronic diseases sometimes separately. And really, it's important to kind of think of them as like continuing healthcare journeys for patients. And there's a lot of data that's backed up by the CDC that shows that chronic conditions and specific ones actually increase the likelihood of specific types of cancer through the patient's journey. So, just to give you a few, so by having diabetes, I have increased the likelihood of having cancer by 50%. Specifically, Lancer, liver, pancreatic, like those colorectal as well. Those are ones that would actually really have a higher increase because I'm a diabetic. The one that jumps out and a lot of folks don't realize is high blood pressure. By having high blood pressure, I've increased the likelihood by about 15% of having cancer. That impact could be lung cancer, can be breast and postmenopausal women, and also kidney cancer. So it's really important that when we think about screening, it's about the whole journey and getting the patient focused on advanced screening, advanced care early. So as they move through their healthcare journey, they're always proactive. And we'll hear later from Bina that actually the sooner we find out, the better off we are.
Wonderful. Let's take a look at the impact of early detection. We know that early detection has one of the biggest impacts on cancer outcomes. It can mean the difference between a highly treatable condition and perhaps a life-threatening disease. Now, this chart that you're looking at here really depicts when cancer is found early before it spreads. Treatment is much more effective, survival rates are much higher, for example, but access to early detection is not equal. And sometimes it creates disparities. Lack of insurance may mean fewer screenings. Transportation barriers may mean missed appointments. Lower health literacy may equate to delayed care. It could lead to things such as later stage diagnosis or worse outcomes in underserved population. However, we talked about it earlier, the home as a clinical hub to improve early detection is critical. Use of at-home screening tests like stool-based colon cancer tests, enabling telehealth consultations, monitoring symptoms remotely. These are all meant to reach people who may not access traditional healthcare. Patty, take us through PLM and really the longitudinal support and how we can engage patients.
Yeah. So as you can kind of see on the slide here, these are the three key pillars of how PLM engages patients in a singular personalized experience at every point in the healthcare journey. So community engagement isn't just kind of like a social network where you're connected to other patients with the same disease. It allows you to connect with peers. So it might be patients with the same subtype of a disease. It might be patients who just got diagnosed. It might be patients who have started a treatment or are thinking about starting a treatment that you might want to get feedback and thoughts from. That's again especially important in these kind of rural populations that we're talking about here. Through the actionable health tools and insights, that's personalized to the patient based on where they are in their healthcare journey, their interests, and also what material is most relevant from a clinical standpoint, but also in terms of like getting them further along that patient activation journey. And I think the final piece that's really exciting, and we'll get into it, I think, with Jay, is connecting all this together in the Fuse network, right? Where these solutions aren't all standing apart from each other. You can actually have patients access them all through one singular experience, because I think ultimately what PLM kind of thrives in is that the relationship with the patient is really crucial to improving outcomes. It allows you to engage patients directly at every step in their journey. We see this on the pharma side. It's increasingly important as healthcare moves towards more D2P, direct to patient type models. And that longitudinal support is actually really just enabled by being a trusted place that a patient goes to find education and get connected to services when they need them. So I think this Fuse health ecosystem is going to be a total game changer, right? Because all these pieces are now coming together to support the patient almost in like an individual kind of record where you can support the patient from early diagnosis through to helping them make treatment decisions and make better lifestyle decisions, and then ultimately get onto the right therapy and then stay on it. And, we see patient engagement as kind of the core engine behind that. But Jay, would love to have you kind of weigh in and give your perspective from the broader Fuse angle.
Absolutely, Patty. And when you think about it, the patient journey is really a complicated one. And I would like to kind of share a personal example of my journey that I think kind of represents this. Probably about 7 years ago, 8 years ago, as somebody who's always been kind of into fitness, CrossFit, those type of things, I all of a sudden found myself where I couldn't manage my weight. The other thing that was really interesting was my temperature regulation had changed. And I knew myself well enough to go to the doctor, and the doctor, did some tests, told me nothing was wrong with me. Said, hey, it's just you're aging, those type of things. And I'm like, this doesn't make sense. I've actually gotten tighter on my diet, things like that. So I did a home health test. I did a couple, and it came back that I had hypothyroidism. And when I went to the doctor still didn't want to test me for it. Finally, they tested me, found out that I did have hypothyroidism, but that was really it. There was no education. The medication they prescribed me, I had to go back every 3 months to find out if it was a right dose. And anybody who takes levothyroxine will tell you that it totally changes your metabolism. And they had me on too large of a dose. So for 3 months, I was on the wrong dosage. So I wished back then that there was an ecosystem around me, because what I ended up doing was the wrong thing. Is you start Googling your diseases, you start looking at Facebook, you start, just you're reaching for straws. And the idea behind the design of Fuse Health and what we're building here is starting with whether it's screening or it's diagnostic, to helping the patient through the journey, to medication, all the way through to having engagement and support tools. Because while thyroidism isn't like usually a life, ending disease or anything like that, it does change your life. And when you feel like you're alone on an island, especially someone who had been previously healthy, it takes a lot out of you. So I think it's amazing that we have built something that can help the patient without using 4 or 5 different vendors to get there, but can get me on the journey and progress through the whole way. Thanks for letting me share, Patty.
Wonderful. Well, that does bring us to the end of our formal presentation. Certainly, in closing, the connection between home as a clinical hub, bridging the health literacy gap, early detection of cancer, which we discussed earlier, and SDOH. It's all about shifting care from one that's reactive to proactive, and from clinic-centered to what I like to say is life-centered. At the end of the day, it's about one main shift, moving healthcare from something that people go to something that's more integrated into how they live. And when the home becomes part of the healthcare system, it really creates more opportunities to catch disease earlier, often before symptoms become severe. So it's the home that becomes a point of access, not a barrier. Jay or Patty, anything else to add here?
No.
Sorry, Jay, go ahead. No, you go.
I was just going to say, I think it is important to think about it is the nation is changing. You mentioned earlier, Bino, the impact of health systems closing. You mentioned pharmacies closing. All those things are happening around us. And it's not just happening in small town USA. It's happening in major areas too. So I think it's important that we just all wrap our arms around these folks, and whether they're educated about the healthcare system or not, and help them through the journey to being healthier.
Yeah, I think Dina and Jay covered it beautifully.
Wonderful. Well, before getting into the Q&A portion of our session, we have another video that we believe drives this message home of this gentleman's healthcare journey. Now, as you all are listening, definitely drop your questions into the chat, but we'll start the video now.
Our family has always been in the cattle business. The farm was built by my grandfather in 1916. And my daughter helps me on the farm when she can. To do what I do, you have to stay in shape. So it's important, if I want to continue to farm, I need to be healthy. My health insurance had Let's Get Checked as a benefit, and so I enrolled in that. They sent me the test kit. The diabetes test that I did was very simple. We opened up the box, read the instructions, and it just went in the mail, and I had the results 3 days later. The results came online. The A1C showed that I was pre-diabetic. They called from Let's Get Checked. What she told me was that prediabetes is reversible. They suggested that I look at doing some changes in my diet and exercise, and that I talk to a health professional. I started keeping a food journal so I could see what I ate and what that would do to my blood sugar, and I found that my numbers had gone down. According to the latest test, I no longer have prediabetes. If I had not taken the test, I probably would have ended up developing diabetes symptoms. I'm very thankful that I caught it when I did. I think it's something that everyone should know because there really isn't much to these tests and the results from them are very valuable. It gives you the opportunity to make some changes and extend your life and be healthier and happier.
Wonderful. You know, as you heard here, this story resonates with thousands, that just the ease and convenience, for example, of testing for diabetes is game changing. This gentleman also kept a food journal and made some other lifestyle changes, which is excellent. But again, it's something that he was able to do and really take control of his own health. Now, I see one question that's coming in here about, let's see, sharing a success story that was a mission moment in advancing SDOH. And I'll kind of take a stab at this. You know, I know all three of us probably have hundreds of stories. And if you don't mind, I'll just tell a quick one here of an old colleague of mine. You know, I worked with someone at another organization who reached out to me about her own personal story after using Let's Get Check's at-home tests. And this was to use this as a test case for her own clients. In essence, she wanted to experience the patient journey herself before talking about this to her own clients. She took her FIT test, and in taking her FIT test, the results came back as abnormal. This then led to a colonoscopy, which then led to a surgery. And she was so moved by the experience that she said to me, you know, I want to be able to tell folks about my personal story. She gave us permission to use her personal story and to leverage her personal story. So if it's okay, I'd love to kind of share a little bit now through a video that she's made about her own personal journey.
It took me about 5 minutes to do the test. 5 minutes that everybody has. That 5 minutes certainly changed my life. I don't know why I didn't get tested sooner. Life is pretty busy and I kept putting it off. I work in the healthcare industry, so I was on a call at work learning more about the Let's Get Checked colon cancer screening. A lot of times we test out our own products and services, and so I ordered the test. Comes in a little box, you open it up, it's got a great pamphlet inside that walks you through each and every individual step. A day and a half after I took the test, a Let's Get Checked clinician called. She indicated that my test results showed that there was blood in the colon and that we needed to schedule a colonoscopy as quickly as possible. When I came out of the colonoscopy in the recovery room, they said that they had found 4 polyps. 3 of them they were able to remove. The 4th one was so large that it was going to require surgery. It was the size of a half of a baseball. I don't think that I've ever been as scared as I was. We scheduled surgery a week later. The doctor came in the morning and said, I just want to tell you that we've gotten your results back and there's no cancer. If it had continued to grow, it would have eventually become cancer. I certainly think about what would have happened had I not done the test. It made me grateful for the things that I have, my family, my friends. The test is what saved my life.
Every time I hear her story, it just brings goosebumps at the back of my neck. I mean, it is truly moving. Let's keep going with some of the other Q&A here. I have one, Patty, this might be a good one for you. You know, as we have moved to virtual healthcare, and we know technology continues to be our friend and foe, either help us or exacerbate the issue. How have you served your patients leveraging what we have discussed regarding SDOH today?
Yeah, it's an interesting one. I think the biggest thing that we give our patients is kind of a trusted digital platform for them to come to get information that's been kind of clinically validated, validated by their peers, and kind of know that like the pathways we are suggesting are relevant to them. So I guess a tangible example is like we recently launched an ultra rare disease, right? So this is a condition where, there's a couple of thousand people in the US. You're not going to find others like you know, on your grocery run, right? So really the feedback been getting from that community is like this is an incredibly valuable resource for them to actually engage directly with their peers and kind of learn what their peers are doing to cope with the condition and their treatment options and how they're actually managing their day-to-day life. Um, so I think that's really powerful when you hear anecdotes like that it's had such a direct impact with people that have kind of been searching around, actually looking to chat to other people that are experiencing the exact same thing they are.
Excellent. Thank you, Patty. Here's another one. There's a lot of anxiety about getting it wrong, and this has to be part of the conversation as well. Are there any lessons learned that you would share with the audience today?
I would say, Bina, for me, like there is always that lesson learned, right? But it's more around focusing on the mission. And what we know is by getting folks to screen earlier, that is what really changes the game. So for us, it's really about, getting folks comfortable understanding the why, education around what the process is, because there's a lot of people that don't feel comfortable with like a fit screening, right? That's not something they want to do. But like we have really done a good job at Let's Get Checked, and patients like me is changing our instructions and our materials to be more for the people. And what I mean by that, when you look at the United States, the average American reading level is between fourth and sixth grade. Our original instructions were pretty lengthy and very word heavy. What we found was we received a lot of feedback about people not understanding next steps. So our operations team did a really amazing job of adding pictures in, removing the words, and using language that resonates for everyone. So right there's just one example of where the most important thing is to get screened. We had to find ways to remove barriers that made people feel even more uncomfortable with something they may not feel comfortable with.
Excellent. I'll just add to that. I also think it's not a one size fits all. As we talk about communication methods, really having what I like to call surround sound around the individual. Perhaps you're reaching out to them through text messages, perhaps it's emails, phone calls, letters, relying on one method of communication and assuming they're going to engage is simply not the answer. It's just imperative that you leverage multiple vehicles to engage that patient. Here's another question that's come in from, I would say, one of my favorites out there. If a patient receives an abnormal result from a Let's Get Checked home test, what is the clinical support available from LGC? That's the first part. So we'll start with the first part. Jay, you want to take that?
Absolutely. So what we will do is we reach out to that patient. We let them know what the results are. Obviously, that's a process that we go through. And depending on the type of test it is, we may recommend them talk to a medical provider. It may be that we follow up and help them schedule additional tests. It depends on what each outcome is, depending on the screening or the test that was provided.
Thank you, Jay. The second part, Patty, this is probably more directed towards you. If a patient wants to be part of the PLM community, is there a monthly fee? Does an employer or a health plan have to be a customer, or can a patient just join directly as a patient? And it says, love what you all are doing at Fuse Health.
Yeah, so Patients Like Me is totally free to join for patients. Any patient can sign up regardless of their employer or health plan. I encourage anybody to check that out if they have a chronic condition and they want to connect with others. Um, uh, we do sponsored programs with primarily pharmaceutical companies, but also health plans and sometimes employers where they're sponsoring it so they can actually provide additional support and services to patients within that community. But for the patient, everything is always totally free.
Excellent. Thank you, Patty. Wonderful. Well, we'll end. We've got one last question here. And I think if no other questions come through, we can end after this one. What motivates you to contribute to the mission of SDOH? And I think each of us probably have a response here. I'll just start. I think what draws me to the mission of addressing social determinants of health is the recognition that health is shaped far more by life circumstances than by medical care alone. SDOH gets at the root causes, but certainly not the symptoms. And you can treat a disease like diabetes or cancer, but if someone still lacks access to ongoing tests or monitoring, that cycle just continues. And finally, it aligns with where healthcare is going. It's more preventive, it's more personalized, it's more connected to everyday life. And so that shift towards a model like home-based care and early detection only works if we understand and address the realities that people face outside a hospital or clinic setting. So if you improve the conditions where people live in, you improve health at scale is truly what I believe.
Yeah, Bina, my aha, or just like the reason I'm passionate about it, started early in my career, and I was visiting a pharmacy in I won't say what state, and a patient came up that was getting insulin, and we happened to be in a retail setting, so their grocery cart was in front of us, and what they were purchasing was not helping their journey. Nobody had educated them on the importance of complex carbs versus, non-complex and things like diet and environment. And we kind of watched the pharmacist then engaged with a really strong conversation. And what was powerful is the patient said, I just left my doctor's office. Why didn't they tell us this? And I think it's important. And they actually put the stuff back and actually got something different. It actually led to a program where we launched dietitians for patients. But it really kind of hit home to me is like, folks aren't being educated like we think they are. And no disrespect, but a lot of times it's a time issue. And by us being able to engage in the community and help them in their home where they have time to learn, where they have time to ask questions, it's opening up the doors because they don't always get that time when they're in the clinic. That just really kind of hit home to me. And that patient I kept up with through the pharmacy team, and just those little changes was life changing for them and also impacted the rest of their family. So it's kind of powerful when you can think of it from that perspective of like impacting one person. One person can make a difference.
I'd pretty much echo a lot of what Jay says. It's kind of amazing how these small changes that people can make that they aren't even aware of can have such life-changing effects. And I think like what's really exciting about what we do here is the actual ability to you both shared kind of one-on-one anecdotes, but the ability to do that at scale is kind of amazing and help engage patients. So we're getting out ahead of them. So they don't run into those issues Jay is talking about, and we're doing that across the board and not just on one-on-one interaction. So I think that's the most exciting thing about this digital environment and stitching everything together.
Agree. Wonderful. Well, that is the end of our presentation here. Jay and Patty, it was wonderful to spend a little bit of the stage and time with you here today. We want to thank our audience for spending their lunch hour or after lunch hour, or perhaps even before lunch hour with us. And hopefully you took away some nuggets that you can take to your own environments and really help motivate and move the needle around healthcare. So again, thank you for your time today and hope you all have a good rest of the afternoon. Bye now.
Thank you all.
Thanks, everyone.